For so many cancer survivors, beating the disease is, believe it or not, just the first battle. Millions are left with this chronic, nagging, sometimes debilitating nerve pain. But what if there was a new way to get some real relief? Well, a new case report is pointing towards a pretty incredible two-part therapy that could be a real game changer.
To really get a sense of just how big this problem is, you just have to look at this number. 20 to 85%. I mean, that's a huge range, right? And that's because this is a massive problem affecting a huge number of people. So what exactly are we talking about here?
Yeah, that's the percentage of patients who get chronic nerve pain from the very treatment that saved their lives. And think about this. As we get better and better at treating cancer and survival rates keep going up, which is amazing news, the number of people left living with this condition is just going to keep growing.
So what exactly is this condition? Let's dive into what the science calls chemotherapy-induced peripheral neuropathy, or CIPN for short.
Okay, to put it really simply, CIPN is nerve damage. It turns out the same powerful drugs that are designed to kill cancer cells can also be, well, toxic to our peripheral nerves, the ones that run all the way out to our hands and our feet. It's a direct and often really long-lasting side effect of a treatment that is literally a lifesaver.
So what does this actually feel like? Well, it often shows up in what doctors call a glove and stocking pattern. Imagine a constant tingling, burning, or numbness in your hands and feet. And we're not talking about some minor annoyance here. This can make it incredibly hard to walk, to keep your balance, or even to do simple things like buttoning your shirt. And the craziest part? For a lot of people, the pain doesn't just stop when the chemo does.
With no really reliable way to prevent it, managing CIPN has been a huge challenge. But this new case report explores this innovative two-part therapy that goes right after the nerves themselves. So let's dig into how this thing is actually designed to work.
It all comes down to this one simple but really powerful idea: blood, space, and mobility. If you give damaged nerves those three things, they have a much better chance of functioning properly. And this whole therapy is built around delivering exactly that.
Okay, so the first part of this therapy involves needling. But hold on, this is a super important distinction. We're not talking about traditional acupuncture, which is based on concepts of energy flow or qi. Nope, this is dry needling. It's a modern technique based entirely on our understanding of anatomy, targeting specific nerves and muscles to create a direct physical, biological response in the body.
So here's the play-by-play for part one. It's called Perинeural Electrical Dry Needling, or PEDN. First, they place these super fine needles very precisely near the damaged nerves. Then they apply a mild electrical current for about 20 minutes. The whole goal here is to basically jumpstart the body's own healing systems, cranking up blood flow and telling the body to release its own natural, built-in painkillers.
But wait, that's only half the story. That's just piece number one of the puzzle. The therapy then adds a second, more active component, something called neuromobilization. You can almost think of this as physical therapy, but for your nerves. Patients do these specific, very gentle exercises, like these things called slump sliders, that are designed to help the nerves literally glide and move more freely inside their surrounding tissues. Remember that principle from before? This is the mobility part of the equation.
All right, so that's the theory. You've got this 1-2 punch of electrical needling and nerve movement. But the big question is, does it actually work in the real world? Well, let's look at the results from the case report, which followed 3 different cancer survivors.
So here are the 3 women who were part of this. And just take a look at where they were starting from. On a pain scale from 0 to 10, patient B was at a 10. I mean, that's literally the worst pain you can possibly imagine. And then look at their function scores, where a lower number means more disability. Patient C was at just 11 out of 80. That means her ability to just stand and walk was severely limited. These were people living with serious, chronic pain.
So, after going through this combination therapy for just 4 to 8 sessions, what happened? Well, this is where things get really promising.
The results were, they were just dramatic. Pain scores plummeted across the board. Patient A went from a 4 all the way down to a 0. And patient B, remember her, the one who started at a 10, the worst imaginable pain? She dropped all the way down to a 2. That's not just a number on a chart. That is a truly life-altering reduction in pain.
And hey, it makes sense, right? When the pain goes down, your ability to do things goes way up. All 3 women saw substantial improvements in their day-to-day activities. Patient C, who started at that incredibly low score of 11, more than doubled her function score to 24. This means a real, tangible difference in their mobility and their quality of life.
So, here's the real bottom line. All 3 patients experienced what researchers call clinically meaningful improvements. Now, that's not just some slight statistical change. It means the improvement was big enough to make a real, noticeable difference in a person's everyday life.
Okay, so these results are obviously fantastic, but what does it all mean in the grand scheme of things? Let's take a look at the potential science behind why this might be working so well and, what happens next.
The researchers think this combination therapy works on a whole bunch of levels at once. It seems to boost the body's own natural painkillers, it calms down nerve inflammation, and it dramatically improves blood flow right where it's needed most. You put all that together, and you create an environment where the nerves can potentially start to heal and even repair themselves.
Okay, now we've got to pump the brakes just a little bit here. It is absolutely critical to put this into perspective. This is what's called a case report, and it only looked at 3 patients. It's an early, very promising signal, but it is not definitive proof. You just can't establish a direct cause and effect link from a study this small. We definitely need larger, randomized controlled trials to really confirm these findings.
Still, even with those caveats, this report offers a serious dose of hope. It points to a non-drug, physiologically based approach that could potentially help manage a condition that just crushes the quality of life for so many people. And the question it leaves us with is a really powerful one. With more research, could a therapy like this one day become a new standard of care, offering real, lasting relief to millions of cancer survivors all over the world?